Welcome to the Global Health Equity Miniseries. I'm your host, Harvey Kennedy Pitt. Join us as we look at 8 public health principles that can help health systems build capacity through adaptation.
Okay, good afternoon, my time, good morning, your time. Thank you so much this morning for sort of coming out of your bed and starting your day with us, Dr. Julian Watkins.
Thanks for having me. Happy to be here.
Okay, well, why don't we begin with maybe you telling us a bit about yourself, just introducing yourself for the sort of people who don't know you.
Okay, yeah. My name is Julian. I am from Atlanta, Georgia. Born and raised out there. Traveled a lot for med school. Went to Howard University, College of Medicine. Before that, went to Oakwood University. That's where we met. Then for my internal medicine residency, in the States, it's separate from med school and residency are separate, and I did it in University of Miami, and that's where I really got my feet wet, if you will, in global health, public health, in addition to, kind of traditional clinical medicine. And then from there, took the academic hospital work route and then ended up in the health department in New York City. First, I was working in the sexual health clinics for a few years, just wanted to do something different, new. For me, I really appreciated the free clinical services in the U.S. context. And then everything really shifted in 2020 when COVID hit and we became this big global epicenter. And then my work shifted from clinical medicine, traditional patients, in a clinic or in a hospital room, to thinking about public health, thinking about city policy, city programs, and just thinking on a bigger scale. And that's where I really tapped into some of those early skills that I got from Miami, understanding, intersectionality, understanding difference, and understanding different needs, and understanding like what equity really means and how one size can't fit all, especially in a city, like New York.
No, that's really a helpful sort of intro. I think that, we were having a bit of a chat before this recording started, and I think that that's even clarified even further sort of what that journey's been like for you. So, and I've been watching sort of from a distance, but that's helped to really clarify, I think, sort of what that journey's been for you. So, I guess in the work you get to do, obviously, it's quite multifaceted. Your journey's been quite multifaceted as well. I guess within that, what type of problem? So, if there's one problem you can identify that you say you're trying to solve, what would that be?
Oh, there's so many problems, but I think there's 2 problems on the top of my list. I would say the first one, and I think what's been buzzing around for the longest, is the problem of white supremacy, and, the delusion of white supremacy and what it's done to our systems, what it's done to our institutions. But I think most importantly, what it's done to our imaginations. I think as a society, as people, as communal beings, that are, have for the longest time lived together, how it's divided and conquered us, and how it's just really degraded these really important concepts such as like love and trust and justice. And I think that one feeds into the other main crisis that's on the top of my mind, which is this worsening climate crisis that we see that is affecting everyone. It's the biggest, broadest, most deep and complex problem that we faced as a species, and just really thinking about how they tie into each other and how what we have been doing and how we've been fighting and resisting against white supremacy can also really help us to reimagine how we order ourselves and our society to help prevent further climate change, and actually hopefully reverse some of the things and work and help to save people and find solutions, to be prepared for what's happening now. So it's like it kind of feeds into each other, but those are the 2 big problems that are on my mind.
Yeah, I mean, absolutely. Thank you so much for just going straight in there and saying those 2 things. I think that we spend a lot of time skirting around the edges, sort of saying,
Yeah.
talking about the secondary or tertiary sort of impact or results. But I think that when we go to things like, of course, you're talking about white supremacy. People might call it racism, they might call it inequity, they might call it xenophobia, they might rephrase it in different ways. But actually, the issue that we're dealing with, it really is around the issue of power and who has that power. So
Yeah.
thank you for emphasizing that. Secondly, thinking about the buckets and buckets of rain that we've been having here in the UK, and everyone going, well, that's odd, this is the wettest summer that we've ever had. And I'm sort of thinking to myself, but yeah, in a public health context, we're talking about global climate, sort of issues and sort of whatever crisis it is, but not linking the 2. And so thank you for raising that
Yeah.
second point as
Yeah.
well. And then, of course, finally thinking about how they thread together? How do they interlink, and how they're related? So thank you for sharing two problems. I did say one, but I'm glad that you've shared those two, and also taken the time to emphasize how they're connected.
Yeah.
So very interesting. And I guess you sort of alluded to sort of equity earlier on in our conversation. And I guess I'd want to know what you say sparks your interest when you hear the word equity, and I guess how you're working to address that in your wider work.
Yeah, I mean, for me, one thing that, when I first came into the work, equity wasn't as much of a big buzzword. There was definitely about diversity, and then there was a lot of talk about these health disparities. And through kind of like entering that realm and understanding how basically humans with higher amounts of melanin, this coloration hormone, that's found in substances found in people's skin and hair. People with more of this around the world globally tend to have worse health outcomes. Just understanding that it basically boils down to that, and all of the other, culture, history of man stuff is just added on top. But the fact that this is the way things are structured and working systematically, and have so for so long, it really kind of just sparked this connection to the bigger, struggle that we're having, around like really like, liberating our minds and the way that we're thinking about things and acting. And so for me, equity, when it makes sense and it brings it all in, but when I talk about it with people in the public, and even my personal life, I talk about the word justice. I think that they are one and the same, and I think that our words do matter. And I think especially, coming from this Black tradition, words like justice or things, it really hits different. Like you feel it in your bones and you know what it is. And often equity, it's hard for people to explain, or it's this thing floating in the air. But when I use, when you evoke the word justice, people get it. Often it's because they've felt the absence of justice, that lack in their life. But people recognize that, and people know what it is, and people yearn for justice, and they know that rights have to be wrong. Wrongs have to be righted, and that there's a lot of unfinished business. So I really look at it in that way, and just like picking up, some unfinished business that needs to get handled, and that it's my time to kind of carry that baton. That's really this equity justice framing, and I think that really resonates for me, and I think for a lot of folks when I'm trying to have this conversation.
I think, yet again, I think that is evidence of the sort of the habitual, I guess, traditional public health practice of skirting around the edges by not utilizing just the words that are the words, call it what it is. And there's something I say very sort of more increasingly frequently, which is that accessibility, diversity, inclusion, equity, accessibility, justice is good for business, because I think people who work in sort of more corporate sectors or profit-based sectors sort of think that it's not their problem. They can often miss those themes as they arise, however they present themselves. I think talking about equity and then thinking about what it actually means, the words that we use to mask, some of the key issues that are impacting populations, as you say, people with more pigmentation in their skin, which I think is brilliant, rather than thinking about sort of the more constructual ways in which we try to navigate and skirt around what we're talking about here. It's fascinating, and you're going right where it's supposed to be, and I'm on the journey with you. So thank you so much for describing it and framing it in that way. I guess I want to take it a little bit further and sort of think about how we, as practitioners, professionals, even non-professionals just watching to learn, about sort of where this conversation is going, how we can make that equity work more intersectional. Because I think there's lots of people who say, I'm working in equity, I'm doing health equity, great. How intersectional is that? So what would you say around how people can make their equity work, their health equity work, their addressing of health disparities, they're dealing with justice and sort of maybe social constructs that are dangerous? How can they make that more intersectional?
I think one of the biggest things is like how we even approaching and entering the work. I think often when we get in public health, global health, all of these things, we enter it through, I think the mindset that we enter it is wrong. We kind of enter it through this kind of colonial Western kind of thing where I am the holder of knowledge, I have all of these things, and I'm going into this other community, of others, these people who aren't like me, who are less than for a variety of reasons, and I have something to impart on them, and I'm going to save them. And then what we really have to do is shift away from that mindset that this existence of difference denotes some kind of hierarchy, shifting to the fact that we're all in this, and this isn't a missionary work, that we're actually in here to save ourselves. We're trying to civilize and really embody justice, externally, but this is for our own good too. And it's really about saving ourselves, saving the societies and institutions and things that we're working for. And that's the one thing. So really having us understand that we're all in it, and that we have a part to play, and that often the work is centered on us, for various reasons, but more than often it's not. And we have to find out how we show up, and work with communities and really work through problems and listen, versus coming in and, oh, I'm not comfortable here, or you don't need this. And it's really just taking a moment and taking that beat to really understand, why am I actually here, right? I think that's the number one thing, to really shift those power dynamics. We talk, you invoked power earlier. I think that is the most important thing, because so many people have the answer, have more answers and more solutions, and have been surviving and really understanding things in ways that a lot of our formal training doesn't give us. You can't get some of this from books, and so it's really understanding that we have a bit of the puzzle, but we don't have the whole thing. And understanding that when we're going and talking to people who are other or different than us, that they may actually have something to teach us or show us, or may hold other types of knowledge. So it's sort of like a humility. I think it's a really understanding your place in this and why you're doing it. So this the intention. And then I think the other bit is the imagination. I think it's leaning into the fact that we should have an openness to to have our minds changed from long-standing thoughts and opinions. If the evidence shows something different, right? It's the scientific method. Evidence shows something different. If we know better, if we've learned more, if we've advanced our knowledge, then we have to be able to lay some of that stuff down. Because otherwise we get stuck defending, medieval policies and ways of ordering people in society that keep rearing their ugly head. And then we kind of see this color stratified society, and it sounds insane, but that's exactly, that's what it is. All that stuff is enshrined in legends and myths and nationalism. But at the end of the day, we have to cut through all of that, because it doesn't serve us, even the people at the top of this hierarchy, because if things are crumbling, and all of this stuff. So it's really about how we can really shift the way that we're approaching the work, the way that we see ourselves in the work, and the purpose of the work. So that's kind of when I think about it, because it's not that you just get some book. It's a daily practice, to really understand what I'm doing, where I'm coming from, and where I'm at. It's a journey versus some certificate that will say you can do equity, you got it. Like that type of stuff, it doesn't really hold the muster, because it's going to get hard, it's going to get difficult. People are going to feel emotionally charged. We're talking about hundreds of years, we're talking about years of dispossession, marginalization, as it's kind of called, oppression. And so people are going to have their feelings, and we have to be able to kind of really know how we enter into this space with the feelings. And a lot of the professional isms and schooling and stuff doesn't really give us a space to actually hold the complexity for the real human story, and those feelings at the heart of what we're actually trying to get at and what we're trying to do when we're talking about systems change and creating an equitable and just society.
Yeah, absolutely. And I know that for listeners that will be dense, for non-public health people, they'll be like, where is this going? For public health people, they'll be like, where is this going? And I think that it depends on, I guess, people's perspectives on how comfortable they feel with navigating maybe what people like to refer to as fluffy, or, that's noise, that's just busyness. We need to focus on the system. We need to focus on the program, the plan, and not realizing the harm that's being created along the way. I guess my question to you would be, what do you think people are afraid of?
People are ultimately afraid of dying. People are, so much of their lives are sitting around trying to do everything they can do to prevent themselves from dying. And some people are so scared of it that they would do everything that they can to push those things onto other people if they think it's going to protect them. Ultimately, that's what it boils down to, and I think that people are afraid of being vulnerable. People are afraid of being perceived as wrong. And we have this thing where we have this good, bad thing that people are always trying to be in the good category. Even if they're doing horrible things, they find a way to, I'm still good, but I'm still good, aren't I? And like, who cares, right? Like, but what is the good that we're doing? And it's like, it's really, those are the things. It's like being afraid of being called out, being afraid of being vulnerable, being afraid of not being seen as perfect. All of these things ultimately get create these situations where people will sacrifice other people, they'll sell you out, they'll sell out themselves for this appearance of being good or this appearance of being this other thing. And I think we have to really move through that fear because it's paralyzing and it leads to guilt, which is another useless, emotion. And like people get kind of stuck in these things. And how can we, for me, it's like, whatever the fear, whatever the thing that's holding people back, what is that message that we have in this equity conversation to help folks see that there's a pathway away from that and through that. And so that's really what I think is at the heart of it all. you know
I find it so funny that you mentioned it sort of being two different opposites, because the opposites that I tend to use are fear and love. People sort of either they're really afraid of something or they really, really love something. And there's a spectrum in the middle of where how fearful people feel about certain things, how much love they feel toward an individual or a group of individuals. And when it shifts too far down one way or the other way, things start to happen. And so, you're mentioning things like humility, you talk about the certificate, the fact that people like to say, I've been on a course, so I can do this now. And how dare you call me that because I've been on a course. Humanity accepts the fact that you potentially never understand that, you never achieve that, and you've got to sort of rely on people's stories by listening, as you mentioned. You're saying things that I think often are less popular certainly here in the UK or other parts of the world in terms of what is cultural humility. What is that? Isn't it competency? And having to re-explain that competency kind of is a myth. It's something that we try to utilize to put into understanding, where we are, where do we stand in relation to other people. But humility obviously is a much more sort of flexible, dynamic term that admits that things are required of us in terms of listening and not making assumptions on certain groups and communities. So that's really going exactly where I didn't know we were going to go today, but exactly where it needs to be. So thank you for that. I guess I always feel like I need to give you more than one call to action here, because I think that what you're saying here includes things like power. You're talking about hierarchy. These are things that come up in reports that I've certainly written that people say, sorry, could you clarify? I'm not understanding what you mean. And I'll let you use your imagination in terms of who's asking those questions. But what would you say your call to action is to the listener coming from various backgrounds, the clinician who's exploring public health, the public health practitioner who's been part of a traditional training scheme, who's starting to explore more, I think more deeper ways of their practice. People who are sort of just curious and just find the conversation quite interesting. What is that call to action for these different types of people who might listen to this conversation?
So many, but I think it ultimately comes down to, I wish that folks would really see and understand the world with more of a sense of wonder, with a sense of discovery, with a sense, I think to see the world as a charmed place. It's not all figured out. The future of this place is not owned by the oligarchs and by the billionaires, and that we have changed things, and that we can, and that it's going to take big shifts. It's going to take a lot of imagination. It's going to take a lot of people power. It's going to actually be from the people. It's going to be grassroots, for the people making ourselves strong and not looking to some savior leader or figure who's going to come in. It's really that. And I think that's the call to action, is that because it's so important, and there's a lot of grudges and a lot of things that have been passed down to us. But we, around today and in this future, we have this big thing that's looming over us, right? This climate thing, and it's getting so much bigger, and we have a lot of work to do. And we're not going to sit here and solve it worrying about these old, grudges from the past, and defending the sins of these forebearers. We have some serious work to do. And it's not about right or wrong about the past. It is what it is. It happened, but we can't erase what that is, because there's many lessons to be learned from it. But I think that's the ultimate call to action, because we have so much more work to do to really imagine that things can be different, and that it's not just this binary thing, that the world is a marvelous place, and that we're discovering new things and learning new things about ourselves and about what we can do, what our capacity is. And the signs are all around when we think about where the language has come, around, these terms to how we engage with each other, around gender, around identity, around really understanding all of that. We can get better. We can do better. We have done it, but we have to really, walk into that, really embrace that, because that's the only way through. The old world is done. The 20th century is over, and we're in this new place, this new phase, where I don't think we can be as petty and small and little and small-minded as we used to be. I think that we have other priorities that we must focus on. So yeah, I think that's the call to action for us, to really get serious about the things that are happening around us, and also to think about what's the future generations. This is not our world. We only pass through this for a short time. Imagine if, and look what we've been handed down by folks who weren't really thinking future oriented. People will look back at this day, and the children will ask, what have you guys done? What did you do to try to fix this situation that now is ours? And so I think about that often. I think that we all should think about that a bit more often. And I think that's the call to action. It's really a more internal, what are all these people going to do over there? It's like, what are we going to do? What are you going to do in your daily life, in your daily living? How are you, building the world, the way you want to live in? What village are you cultivating? What's our daily liberation practice? What are we actually doing on a daily basis? You paying your taxes, you brushing your teeth every day, you cut the yard. What are you doing to make this world better and to save this place, to clean this place up a little bit? Yeah.
I mean, you've been on a journey, it makes me curious as to what role, and this is a bonus question, maybe one you're preparing for, but a double bonus question, actually. What you feel your journey as a medic, as a clinician, and turned public health, sort of connoisseur advocate, how was that journey over when's the last time I saw you, maybe in physical sense, 15 years ago? How was that, sorry to call your age out, but
It's fine.
how was that journey changed you? Because it has to have changed you. It has to have done something different for you.
Yeah. I mean, for me, it's been this journey, this process. It's been a growing up. I think it's one thing to kind of, in my life, I experienced this big transformation, just going from a regular person every day to becoming a doctor, and you see life and death in this really intimate way, to be a part of birthing a child, to, the end for many folks, and being there across that whole journey, it gives you something that's access to the human experience in this real way, where you just understand, boiling it down to it, those are the only things that we are guaranteed, is that, that we are going to die. We've all been born, we're here, and it's hard in the middle, and so between that work, getting into, HIV, sexual health, and being more of like an activist in the way that I approach the work, to then COVID, I just knew that at the beginning of this pandemic, after walking these streets of New York and seeing how that last pandemic, seeing how, the pandemic of HIV, how that still alive in the streets and in the hearts and minds of folks, and it's on people's tongues, seeing that, knowing that COVID represents something similar, but also something that we haven't seen before, I entered this process like, I want to be useful. I want to be helpful, and I do want everything that I have that's in me, all the power that I have and possess, I want to use it for the liberation of my people. And when I say my people, I'm always talking about Black people, but I'm talking about a lot of other people too. And so it's really this journey to really try to bear witness, and having seen all of these things and felt these things deeply, to really talk about this truth, and to really, it's, I don't know, coming from where we come from, spread that light around the world, because there's so much darkness. And it just comes down to, I felt that my practice extended beyond the four walls of a clinic. And so that's the journey, has really been like identifying what is my practice, in the kind of more classical sense, not just my clinical practice, but what is my global practice, my practice to the world. What do I have to say? What's my work? So that's been the journey. Really, just want to be useful during my time here, and wanting to bear witness, I would say, in a really true sense, and really not let ego and all that other stuff get in the way.
Because I don't know if you're aware, and thank you for sharing that, it's quite a well-known thing that there are lots of strikes going on in the country at the moment. Teachers are striking, nurses are striking, doctors are striking, and even train drivers are striking. Every day there's something going on. And I think certainly thinking about what that means for existing medics, clinicians who have come to the end of their tether in terms of what they feel their purpose has been as a clinician, whether they're junior doctors or they're more senior consultants, they really have to make a decision on what they're going to do next. And so we're starting to see a lot of people transitioning out of medicine, sort of into public health, and sort of wondering what their place will be. I guess I want to just ask briefly what that transition was for you out of the clinical space when you sort of went, right, now this is a public health issue that we're dealing with here. I can't just sort of keep turning over patients here if I'm not, being able to do something a little bit more in depth. I don't want to put words in your mouth, but that is a very common theme. What was your journey sort of from, just briefly, from making that decision as I'm just a clinician, I'm just doing my job here, and I want to do something a little bit more than just maybe just bedside care or seeing patients?
I mean, it was just, in the US, we have this kind of for-profit system, and I wanted to get out of that. That's when I went into this free public health system. We have 8 free sexual health clinics across the city, which is kind of stands out in terms of US cities and how we structure things. So there was that. But then, and I was doing that work, and I was in those sexual health clinics and thinking about policy and talking about things. But when COVID came, it felt not that I felt that my work and my skills and what I saw and the vision I had, that I could be more useful in other places. And so it was a very difficult decision to leave a regular routine clinical practice and kind of go into this uncharted territory. But I knew that whatever it was, I was willing to do it. I was willing to become it. I was willing to learn it. Even if I was unrecognizable to myself at the end of this process, I knew that the people, our people, my people, need someone who has an open heart and an open mind and is good to tell the truth and can communicate these really difficult, complex, ever-changing things to people. And it felt like such a great way to spend my time and energy. It's like, okay, I'll do it. Hadn't had like some of these formal trainings, but I will do it. I will educate myself. I'm a lifelong learner. I've done hard things before. Let's go for it. And now 3-4 years later, here we are, and I'm doing it on a pretty high level, and it feels great to kind of be able to have the vision, and then really work really hard in community, and to kind of ultimately kind of achieve something that was just just a dream.
So tell me what you mean by even if I'm no longer recognizable to myself, because I think that, we talk about health equity transformation. What are we transforming? We're not just transforming systems, or we're not just trying to change systems and processes or policies only. We're actually going through a process of changing ourselves and our way of thinking. So what do you mean by not being recognizable to yourself?
Yeah, so for me, it's happened a few times, and I think the first time that it happened, and it feels transformational, going from, a private citizen, going through this process of becoming a doctor, entering into this, I don't want to say brotherhood, but this human, legacy of healers, and really seeing and understanding that in the Western sense, there's this way and this white coats, but it's been going on for thousands of years, and there's so many different healers and all of this, and recognizing that, and tapping into it beyond just this kind of Western kind of formal way of seeing it. So many ways of healing and knowledge and cultural practices and other things, and really wanting to lean into being that healer. And it's at the other end of these journeys and these self-growth processes, or even further down the line, because it's a constant journey, the further you get down and you look back, you've gotten some new battle scars, but you have a few people who have joined you on this journey along the way. You may have a few more gray hairs, but you ultimately do feel and are different. Some sense of you has changed in the inside. And I think, not to say that the old person is dead, but there's a growing up process. So it's truly that. And ultimately you forget what it was like to be 16 in the physical in your body, but you never fully forget it. But you are a different person, and it's a beautiful process. It's scary, but I think it's a beautiful, transformative, generative process that's helped me make it and keep my stuff together these last few years, with all of the things happening, all of the tragedies, between all the assassinations and all of the protests and all of the strikes and all of the climate change. Like, between all of that, it's like there's a still quiet daily practice of like, wake up, what am I doing today, to make the world a better place, and how am I living that and embodying that? And yeah, it feels unrecognizable. I was not Zen and all of this forever, but it's a journey. So yeah, that's kind of what I mean.
So empowerment through growth and survival through growth, and being open to growth, and all of those things. But the key word there being growth, and there's a requirement there for all of us, regardless of where in the system, the global system that you're working, what you're focusing on, you're trying to tackle, that growth is a requirement. It's a requirement if we plan to actually do anything of value and substance. So yeah. So that's amazing. I am sure that you know, anybody who is watching this will definitely want to find out who Dr. Julian Watkins is. They need to know, who is this enlightened person who has left me with all these questions to go away and think about and explore. They want to know more about your work at the very least, and know how they can get in contact with you should they wish to collaborate or learn more. So how can people get in contact with you?
I'll share my LinkedIn. And I would say one of the great things about working for the New York City Department of Health, we have a pretty decent, website. I tell people to go, I mean, I'm speaking as a private person, not as a, not representing the agency, but the website is really, I think is really helpful just for like different topics. And a lot of the work that I do and a lot of projects that I work on are actually on the website. So it's, I would say you check out my LinkedIn, and there's a few important things that, that I talk about and we talk about on, on our website. We talk about health equity, we talk about this declaration that was made, through the support of our agency, declaring racism a public health crisis in New York City. So I feel like, I'll share my LinkedIn, and then check out some of the other work.
No, please do, please do. Julian, I'm humbled by seeing the journey that you've been on. I have a very, very annoyingly very good memory, and so I tend to when I see people after quite a long time, I know who I knew them as, and I get to then also compare that to who they've become. And I don't want to say impressed, like that's my role to say that, but I'm certainly inspired, and I'm really glad that we were able to have this conversation today, because you certainly given me a lot to go away and think about. So thank you so much for your time.
Thank you, Harvey. So happy to be here, and thanks for reconnecting. Appreciate, I have a good memory, probably not as good as yours, but to see to see people grow, and to have a chance to engage and talk about these important issues, especially now, two Black people talking about these issues from the perspective that we kind of come from and the communities that made us. I think it's so important. So I just appreciate the opportunity to reconnect and to talk about these things that I care so deeply about.
Absolutely, loud and clear. Thanks so much again.